Hello everyone, welcome back to Breastfeeding Answers That Work. The empowerment statement for this channel is to be patient, be persistent, and to be proud. I've gone over what each one of those things are in the first two videos that I've made. To be patient means you need to remember that it may take time for you and baby to learn to breastfeed. It doesn't always come natural, right away. It can take time for the baby to learn. It's also important to be persistent, which means to not give up. Because you will have some challenges possibly in the beginning. You want to be persistent, not give up, not give into a bottle too quickly, because then it can make your problems bigger. So you just want to be persistent, again, because it can take several days up to several weeks for you and the baby to get good at breastfeeding. And this is where the being proud comes in. When you are patient and you are persistent, you eventually get very, very good at breastfeeding. This could happen, like I said before, several days or several weeks. But then when you get there, you're going to be so proud of yourself because you made it, and the gift you gave your baby is something that is going to last your baby a lifetime because of those risks I talked about. For you, you lower those risks for you and the baby. So we talked about diabetes, we talked about SIDS, we talked about obesity. All these things are benefits when you breastfeed because you lower those risks of those issues. So that's our empowerment statement. And I started with my intro, the first video, and then the second video was how our breasts make milk. That was part one. I will continue talking about milk supply throughout other topics, which will basically continue the milk supply video, but it may talk about other little things first. And so, for instance, the question, how do I get started breastfeeding? This is going to talk about things that will help your milk supply. So in a way, this could be milk supply part two, because everything I want to talk about today is going to ensure that you have a successful breastfeeding experience. So the first thing I wanted to talk about is to breastfeed right after the baby's born. It might be good to make a labor sheet that you want to show the nurses this is what you want, this is what you'd like to do, and then add in there that you're breastfeeding so that you can get at least an hour with your baby after you deliver so that you guys can practice breastfeeding. And then that first couple of days in the hospital, you want to breastfeed as much as possible. That's going to help you and baby to get off to a good start, because in the hospital, you should have a lactation consultant there to help you, to guide you to get to know if everything's right. Like, we talk about it, but when it's actually the baby's actually in your arms, it could be something different altogether. So you want to get the help while you're in the hospital so that you benefit from that good start in the beginning. Another thing that's important, and I would say to do this before the baby's born, find a very comfortable chair, maybe with a little stool, that you plan to use when you're breastfeeding. Because what's really, really important is that when you're breastfeeding, you're comfortable. So when you are holding the baby, you want to bring the baby to you and not you to the baby. So you would be wanting to sit up, have pillows around you if need be, to support your back and support the baby. You can bring that baby up to the breast, and there's different positions. You can use the football hold, which is basically you're kind of holding the baby under your arm. The cross cradle is where your arm crosses over this way, and you're able to control the baby better when you do this cross cradle in the beginning, because you're able to kind of guide the baby to the breast with your hand and still have your left hand free to support your breast. Another position is laying down, but I don't really recommend that until maybe about 2 or 3 weeks when you're getting a little bit better at breastfeeding, because that can be a little bit difficult for you. And then, of course, you have the cradle position, which is the most common position you will see, because many women, that's how we breastfeed, especially as the baby gets older, because once you put them in that cradle position, the baby knows exactly what to do. It grabs the breast and it starts sucking right away. So typically that cradle position is one that you'll use very often as the baby gets older. Then the next important thing is to learn to hand express your breast, because it's important that maybe you can especially if a baby's having trouble latching, for you to express a little bit of that colostrum out. Sometimes it's good if a baby's sleeping and you want to kind of wake them up, you can kind of drop a couple, drops of the colostrum into their milk. So it's really important. I'm going to read what it says in this book about how to express. So you're going to place your thumb and your fingers opposite of one another on the areola, the darker part of the breast. Press against your chest, then compress, gently squeeze the breast, not the nipple, between your thumb and fingers. So it's kind of hard to understand, but I know there are a lot of videos that show exactly how to hand express. Quite a few are out there to help with that. And then you also have your LC in the hospital, and I would definitely ask her, show me how to hand express. Because when your milk increases by day 3 or 4, you might want to be able to get some of that milk out using hand expression versus using a pump, because it's better for your breast if you can hand express versus a pump, because your breast is already swollen and sometimes pumping can make it swell more, so we don't want that to happen. Another important thing is to support your breasts. It's important to think about when you're supporting your breast that you're doing sort of a U hold versus a C hold. If a person's showing you, they're more likely to do this, but with you holding the baby, you're going to be doing this. You're going to go up this way versus this way, because you're going to have trouble with that. But if, let's say, I were helping to latch the baby, I would use a C hold because I'm opposite of you. So that's important. Also, you want to support your baby, so you're going to place your hand around the baby's neck. For support, it's better to hold the baby at the neck than up on the head anywhere, because the baby has this natural reaction because when they hit the area to come out of the, to be born, their head is touched at a certain point and they push their head back so that they can get out. So when you touch that part of their head, they automatically lift their head backwards. And we don't want that with breastfeeding, because then they're not going to latch correctly. So try to support their back of their neck and not really touching the head too much. You're probably going to tickle your baby's nose with your nipple, their mouth, and then they're going to open wide, and that's when you want to put the baby on. You don't want to put them on when they're just opening very little. You want it to be wide, like if they're screaming, which we don't want them screaming, but you want their mouth open that wide. And if you tickle their lips, you touch around them, the chin and the nose, they will tip back and open their mouth wide, and that's just a natural reaction for breastfeeding. Then you want to hold your baby close. You want belly to belly, the baby's belly against your belly, and their nose and mouth in line with your nipple. When you're holding that baby, hold them close, and just remember it's belly to belly. You don't want them laying on their back and having to turn their head to feed, because even us, if we're turning our head to feed or to eat, it's difficult to swallow. So you want to make sure that baby doesn't have any more difficulty than he needs to have when he's learning. Again, you want to make sure you check the baby's nose, cheeks, chin, and lips, that they're all on the breast, and that your most important thing is to see the jaw moving. You don't really want to see dimpled cheeks. You want to see the jaw moving. This is going to show you that they really are eating, and then you want to listen for a swallow. So it's usually a suck, suck, swallow. It could be a little bit more, or it could be a little bit less. It could be suck, swallow. But we want to see, you want to hear them swallowing. That's very important. And one thing I really try to tell moms is to watch your baby and not the clock. The important thing is the baby feeds 8 to 12 times a day. So you can count feedings, but don't worry about necessarily, okay, they haven't fed long enough, or, they say 15 minutes and you have to switch breasts. We don't want to worry about that. Just let the baby breastfeed. When they come off, then you can burp them and either move them to the other side or bring them back to that breast. Depends on how you're feeling. And also, when you take the baby off, you want to break the suction. So you're going to take your pinky finger and you're going to put it between the baby's mouth, inside there, push down. The baby lets go, and then you're able to pull your nipple out. You don't want to just pull the baby off. That's going to cause a lot of bruising and sore nipples for you. So just remember how to take them off. You can always offer both breasts at a feeding, but don't worry over much that the baby doesn't want the second breast, because they can get a full feeding on one breast. But like I said, let them let go. Let them feed as long as they want. When they let go, you can burp them and see how they are. If they seem content, fine. You can offer the other side, and if they don't want it, that's fine. If they do, then you put them to the breast and you let them breastfeed. And then the important thing is, if they do breastfeed but not very long on that second breast, you want to start on that second breast first. If they miss a feeding, they just do one breast, and of course you would do the other breast at the next feeding. So that's important to remember. And also, like I said, you want to watch the baby, not the clock, but you do want to make sure you're feeding your baby often. So typically it should be every hour and a half to 2 hours. Sometimes it can go up to 3. It shouldn't be every 3 hours. In the first couple of weeks, it should be you want more than that. They might have one part of the day that's 3 hours, but you kind of want to keep a newborn on the breast quite often in that first month, because that's going to build your supply and make sure the baby has enough milk for as they get older. And then another very, very important point that I want to mention is that while you and baby are learning to breastfeed, especially the baby, you don't want to offer a bottle or a pacifier yet, because that will confuse them. Now, it doesn't mean you can't use the bottle or the pacifier in time, but I would say wait at least 2 weeks before you introduce a bottle or a pacifier. And if the baby's latching really great and you're having no issues and you've tried the pacifier and the baby seems to switch okay, then that's fine too. But it tends to confuse babies, especially if they're struggling with latching, to just stay away from the bottle and the pacifier for a couple weeks. And then, of course, you can introduce that later on. So that's pretty much all I wanted to talk about today. That breastfeeding, those first few weeks, breastfeeding as often as you can is very important to your milk supply. So in order to make sure you have enough milk, you want to breastfeed as often as you can, especially in that first 4 weeks, because it's by 4 weeks that your body has started to make the amount of milk that it needs to make, and it lays receptors to the breast to be able to hold more milk, and that's what we want. So I hope that this helped answer any questions you might have, and I hope to come back and talk more about some other, I think the next one was, let me see what it said. The next thing we talk about is how often should I breastfeed? As we talked about, watching the clock and not the baby. That's all important, but we're going to learn a little bit more about how often I should breastfeed, because breastfeeding, it's how often you should breastfeed versus how long you should breastfeed. So we'll talk more about that next time. So I hope you enjoyed the video. I hope it helped. Please subscribe, and if you have any questions, feel free to email me. Thank you very much for listening.